Absolutely. Yeah, that's what we talked about earlier. I hope, because like I said, worldwide, there's a worldwide interest, and also the worldwide right now, the controversy, the argument, debate on vitamin C is reaching its peak.
Yes.
And the mainstream medicine is still having an upper hand. However, the vitamin C camp is gaining momentum, and the reaction is very typical. So what you see in Turkey is the same thing as in UK, as in United States, as in France, as in Germany, as in Estonia. Yesterday I was interviewed by Estonia newspaper, and so they put their article on the website. Within 15 minutes, 15, there were 20,000 reads. But then the doctor group came back, and so they took it down. But then the journalists talked to the Congress people. They have Congress people, Congress members on their side, and talked to the newspaper editor-in-chief, and they put an article again online. So this kind of fight is right now, is heated, and but I'm pretty confident because of many people. Because actually, there are more doctors utilizing vitamin C in the treatment and prevention than we realize.
Yes.
And for example, this morning I saw news that the Philippines is distributing vitamin C freely to the children.
Yes.
Right now.
Yeah. Right.
So I am sure following this, there will be more reports, studies, coming out, and I think this will push the vitamin C to a much higher level. And actually, there's a recent paper on, I'm sure you know his name, Dr. Fowler, from Virginia Commonwealth University.
Yes.
So basically, in that, he summarized. It's a review article about vitamin C in the treatment of. The title actually is "Vitamin C as a Treatment of Sepsis," and this ARDS, this COVID-19 ARDS is a sepsis. Yeah. So I do feel in that article, Dr. Fowler actually predicted that he feels, this vitamin C will become more of a standard therapy for sepsis.
Yes, yeah,
and of course,
enlighten our viewers. As you know, the Dr. Marek and Dr. Fowler has started this study called Victas, and they are using along with vitamin C, thiamine, and also steroid, as you know, is as a protocol. And right now, out of 2,000, I believe they reached a peak of either 1,000 or 600 patients. And then preliminary data they are crunching is amazingly confirming what the Dr. Marek did it over there. So, but it's very low dose. It's only 6 grams a day.
Marek's original dose was 6 grams. Marek is a little bit different. I spoke with him not long ago.
Yes.
And he has his point. Basically, his argument is that vitamin C is a antioxidant and also is a pro-oxidant. And so you want in the scenario of like ARDS, where you have increased oxidative stress.
Yes.
Now you want the antioxidant property of vitamin C.
Yes.
But for the virus killing ability, you want the pro-oxidant effect of vitamin C. Now, how do you draw a line in between?
Yes.
Now, that is a valid point of debate. But given the cases, I'm sure Dr. Fowler reported a case of a young girl visiting Italy. Actually, he reported this girl was developing quickly ARDS and went to ECMO ICU, and this girl was receiving 20-some grams of vitamin C and recovered fully within she was out of ICU in 7 days.
Yes.
So, many other cases, including New Zealand cases, So, for all those cases, the dosage was much higher than the 6 gram that Dr. Marek was using. So, I think Dr. Marek, talking to him, I got a sense he's a little bit more too conservative.
Yes.
So, I would say his dosage is just barely the minimum.
Yes.
Among the, there's a International Society for also molecular medicine.
Yes.
And the vitamin C is more of their focus, and directly descended from Linus Pauling and Hofer. So actually, the general consensus which I agree as well, is that we feel for COVID-19, I would go for 30 to 60 grams of vitamin C daily. Yeah, that's just up and down, because because we haven't really seen any side effects to high dose of vitamin C. For example, I've been treating actually Turkey. There's a group in Istanbul. Forgot their name, but they've been doing this metabolic therapy for cancer. I also received the fellowship of training from A4M on integrative cancer from Mark Rosenberg.
I just watched the video from this physician. He put a nice video and explained how the vitamin C should not be worried, because he's an oncologist and then he's giving high dose. He says very high dose. I don't remember his name. I applaud him for this video.
Yeah, I give patients routinely 100, 150 grams of vitamin C to cancer patients.
Okay.
And I don't see it. There's no side effects, and I don't see the pro-oxidant side effects of vitamin C. So of course, Dr. Merrick is an ER physician, and he doesn't deal with chronic patients. He doesn't deal with cancer patients, as I have seen here in, for example, Shanghai case. Yes. Dr. Mao, whom I interviewed, will interview again recently. I mean, the next couple of days. He's also an ER patient. They don't deal with cancer. Yes. Anybody who's been dealing with cancer with IVC, we use much higher dosage. Yes. Yes. And we don't see any problem. Why, when we use half of this, we have a problem? So that's because for me that's very comfortable.
Let's create a protocol for ICU doctors who's trained well. They like to have protocols. So hypothetical patients. Let's say we got an ARDS patient, and ventilator settings going towards ECMO settings, and then we have tons of patients waiting to be actually intubated. So to save this patient from going down the hill, save the life, do you think safely we can do a bolus of 50 gram first, and put on a drip of another 50 gram 12 hours, and see what happens?
Yes, I would. For me, I would put a drip. I mean, I will put 30 grams or 20 grams within the first hour.
Yes, and then let's say
quickly,
based on
and then followed by.
I'm
sorry. Go ahead.
Yeah, we reduce the dose based on the response. Is that right? The ventilator settings
Now, first of all, don't worry about reducing the dosage, because again, I have not seen, and also reported in the literature, and particularly people like authority. Okay, I always like to mention a NIH document, although that because that's authoritative. People consider that authoritative. Yes. High doses of up to 1.5 gram per kilogram body weight is safe. Okay, for somebody with 70 kilogram body weight, that's 100 grams. So don't worry. Don't worry about reducing the dosage. Okay, go. And I would say stay with high dose until patients are much better.
Yes.
Don't immediately, because that's what are we worried about? Yeah. There has never been a study to prove the renal kidney stones are due to vitamin C. Now, that's a different story. I can talk a lot about. Yeah. The vitamin C is not the cause of a kidney stone. It's the calcium. Yeah. It's all the oxalic acid in your vegetables. Okay, but we're not going to go talk about that today. Okay. So vitamin C, there has never been study to prove that.
So let's go
other than kidney stone.
Yeah. Let's go to the second hypothetical patient. Let's say one comorbid, maybe no comorbid patient, but issues, but it's very high fever, very tired, and then just shows up in ER, and then usually this patient sent home. What would you do before you send these patients home to make them feel better and faster? And what would you recommend? If you have a way of doing it, IV.
Put an IV, right? Since we are talking about vitamin C, put an IVC.
Okay.
Let him rest in a lounge or in a bed. Give him a 20 grams IV drip or 30 grams IV drip over 2 hours, and let him rest. Give some other supportive care. But I would be careful not to use ibuprofen, Tylenol type of medicine, and because those, as you know, they hurt our livers and other problems. And you can give, if the temperature is too high, you use physical measures like the alcohol rubbing of the neck and a cold towel, that kind of thing. And because the patient will recover, will improve pretty quickly.
How about quercetin? Quercetin bromelain.
Quercetin,
would it be a nice choice?
Okay.
Yeah.
Now, if we want to expand, okay, actually, so you and I are both in the integrative medicine side of the business. So I have actually a formula for these basic, not only, alpha-lipoic acid, the glutathione, vitamin D. Don't forget my vitamin D.
Oh, that's the second thing I recommended,
Yeah, this is what I usually do, because there's many different ways we can do. But, for you and I, we have to, because, in the international, also American medicine side, we had a debate on this. And also I agreed is that we need to stick with one point.
Yes.
You don't want to give too many different messages to the public or to the doctors. They don't even understand vitamin C, let alone all these other things. You confuse them.
Yeah.
All we want to stay focused.
Let's start with the alphabet. Let's start with C and D. Like we start first portion of alphabet, when we go to the Z's and D's and later on. But you're right.
Exactly. Yeah, absolutely right. Vitamin C is not the only thing I will use. Okay. However, when I talk it on the website and in my lecture, everything. So basically, I always focus on vitamin C. Yeah. Once people believe you, then we expand. Vitamin C, vitamin D, alpha-lipoic acid, vitamin E, vitamin B. What I really call is the total nutrition. Okay. And you need the mitochondrial nutrients as well, because these patients have this kind of a poor scenario. They really have a messed up metabolism. Yes. You need all those vitamins if possible. But so we have to open the dialogue. We have to let the public accept the vitamin C is good first.
Yes, you're right on it. So I think your mission is same as my mission.
So once vitamin C is, once we tell them it is safe, okay, then the second question is only about whether it's effective or not. But also we tell them right now, you see, with COVID-19, we don't have any better treatments, right? The fact is that we don't have any good treatments. Yeah. So this thing, I'm telling you, it may have effect and it is safe, so it doesn't hurt to try. Then that's how we can open a conversation with them, okay? Because doctors, if it doesn't hurt, they're usually willing to consider. Yes. So that's, I feel, how we can send the message, And this is important.
We have results. And third thing, we have good results from your own experience down there.
Exactly. So other doctors are trying. You saw it. New York hospitals are trying it. The Chinese hospitals have been trying it. And right now, let me see, the Japanese, the Koreans are doing it.
England,
okay, and
they are doing in England also. I heard actually.
It's getting there too, because England has been a little bit. Yesterday, I talked to a group in England that's been UK. They are frustrating too. So now there are other places trying. So don't have to worry. So once that you get their attention, because I have a sense, actually many people don't really know about vitamin C.
Yes.
Now yesterday, because I got through these questions, this newspaper editor-in-chief in Estonia asked, she asked us, she said, well, if vitamin C is safe and so good, why are people against it?
Yes.
I think that's a fair question.
Yes.
She probably never really knew about it. I think a lot of people are like this. Why it's good, why people don't use it?
Yes.
Then, of course, then we start telling why the interest groups are against it. Then that's how we start talking about the anti-aging or alternative medicine. The concept, that's what I mentioned earlier. Vitamin C argument is not just about vitamin C, right? The debate of vitamin C is not about vitamin C, actually. It's more about the concepts, how we approach diseases differently.
Yes. So,
and hopefully, actually, I want to summarize this, is that I think this is a good momentum for us anti-aging physicians, is that once this is over, and I think we will get a lot more attention on vitamin C. Then we start talking about other chronic disease aspects of vitamin C.
Yes.
Okay. Yeah. Actually, one of the points I want to make here, and you can talk to other people as well, is that look at the worldwide. We are expecting vaccine, right? We are all expecting a vaccine for COVID-19. But let's talk about vaccine a little bit. I'm not against vaccine. Okay. Let me put it this way.
Same here.
And I wish we had a vaccine today for COVID-19. But let's look at some numbers.
Yes.
Now, first of all, look at the epidemics. If you look at the Wikipedia, yes, in the 200 years of 19th and the 20th century, there were about 70 epidemics.
Okay.
And those epidemics that caused more than 1,000 deaths, there were 14.
Yes.
So there were only 14 epidemics or pandemics in the 200 years before this century.
Yes.
However, this century, only 20 years in 21st century, on Wikipedia, there were over 60 epidemics. And 11 of those were big, was more than 1,000 fatalities. Okay. My message is that in the 20 years, we have seen 11 major epidemics compared to 14 major epidemics in the last 200 years. So this is probably not as scientific as you like. However, it is showing me a disturbing trend that seems like epidemics and global pandemics are increasing in frequencies. Okay, that's one. Number two, we have never had a vaccine developed in a timely manner to be deployed for most people's use in affected areas worldwide. Okay, we didn't have a vaccine for SARS 17 years ago. We didn't have a vaccine for MERS that was 7 years ago or 8 years ago. Okay. We didn't have a vaccine for Marburg virus epidemic. We didn't have a vaccine for Ebola epidemic. And we don't have a vaccine for COVID-19. Why is that? Is because vaccines for this type of abrupt outbreak of viral attack only happens after an outbreak. It's just the nature of vaccine. And then the research, development, and the manufacture, clinical trial, all these things of vaccines takes a minimum of 2 to 3 years. Yes. Okay? Because that's the nature of the process. Yes. Again, I love vaccines. Please give us a vaccine, but we don't have it. And we don't have it today. We didn't have it before. I'm telling you, until this nature changes, I don't see how. So my conclusion is that in the foreseeable future, the way I can see it in my lifetime, we will not have a vaccine ready when another major outbreak breaks out next time.
And let us get experience with vitamin C and the ozone and the hydrogen peroxide and glutathione and see what happens. Yeah. The
conclusion here is very clear, is that we all need to wake up. This is for the mankind. Let's forget about money for a while, because when COVID-19 hits the world, most of the businesses will lose money. Yes. It doesn't matter where you are, right?
Yes.
Most of the business country people will suffer. Yes. So this is like World War III. Except this time the enemy is a virus, not some other country. Yes. And so we need to rethink of our strategy of this type of outbreak. The strategy is that vaccine research and development is one way, but not major way, because it's not able to, it's too slow. We need other ways, like you mentioned. Here the message is that we know to boost our own immunity, we need universal, non-specific viral killing and stopping methods. And vitamin C, vitamin D, ozone, hydrogen peroxide, the methods we've been describing, these are a valid, safe, and effective way of the toolbox. Okay, we can have others, whether it's native Chinese medicine, Tibetan medicine, it's fine. We can explore all of these. And then what we are saying, you and I, our colleagues in the field are saying that vitamin C, D, or these anti-aging or alternative medicine ways, they will have plenty of basic research, plenty of clinical studies, and enough rationale mechanism behind it. We need to face this thing squarely. And that's hopefully, that's my message. And I want, hopefully, worldwide, we can get this message.
Thank you, thank you. You just like to be were actually is like a voice to all my thoughts wholeheartedly, and thank you very much for joining us. And I'm looking forward to invite my colleagues and myself to your vitamin C COVID-19 Zoom meeting. And then I'm sure we will be making more short videos within upcoming weeks. And then let's focus on just getting the word out. And then patients should start asking, actually, where is my vitamin C? If they hear this video and then information, if their doctor is not knowledgeable about it, let them just talk to the doctor. Tell them we are willing to educate them. We are willing to share our knowledge, and we are not asking for money. We are not asking for anything. It's all out there. Simple.
We're in the same boat. We're in the same, but the whole world is suffering from this. We want this to stop. Because it's affecting everybody.
Yeah, and one life is saved is one life, and then just let's focus on it. Yeah. All right.
Now I'm stuck in Shanghai. I cannot even go back my home in the United States. No flights in between.
Yes, same thing.
I want to go back to normal.
Yes.
I want to go back to normal routine, but now hopefully I can go back to the United States before summer or in summer time. Yes. And unfortunately, this is, we need to face this squarely. Let's forget about money issue right now. Yes. We need to really dig into the truth. Yeah. Well, thank you very much for having me.
Thank you.